when you have some sort of infection, because your immune system has to work harder to fight it. And so it's really nice to have a glance at these numbers, because sometimes they may appear to be normal, but if you look at them functionally, they actually could be a little bit high, cluing us in that maybe there's some underlying infections that we're not aware of that could be going on in the gut.
Welcome to Get Pregnant Naturally, where functional medicine and natural fertility solutions will help you get pregnant and have your baby. Hey everyone, I'm Sarah Clark, and my mission is to inspire, motivate, and empower you. Most of all, I want you to wake up. So with functional medicine, we can discover what causes infertility and eventually reverse the condition. Today, I'm welcoming Brandy to the podcast, and we're digging into blood chemistry and looking at the results using the tools of functional medicine. So definitely check out episode number 6 for a functional medicine 101 talk, plus a look at some of the tools we use to help couples conceive. So Brandy is a functional diagnostic nutrition practitioner and a certified transformational health coach and emotional freedom technique practitioner, which is tapping. She loves supporting women so they can learn how functional medicine addresses the underlying cause of disease or illness. And before we jump into today's show, don't forget to hit the subscribe button on iTunes or wherever you're listening to this to make sure you never miss an episode. Hey, Brandy, excited to have you back on the podcast.
Hi, Sarah. Thank you for having me.
Awesome. Yeah, we're going to dig in today to the blood chemistry and really looking at using the tools of functional medicine for this and sort of giving us clues as to what's happening. And this is really super important too when, you've been told that all your lab work is normal, whereas in functional medicine, we'll give you that much needed second opinion. So a conventional doctor is going to look at pathological reference ranges. So these are used to diagnose disease. So if the test is at a range, it usually indicates potential for pathology or disease, but we really believe, looking down a panel and saying everything is normal because it falls within this pathological reference range is really a huge disservice to the patient. So we offer this as part of our couples coaching program. But Brandy, do you want to share a little bit about the blood chemistry review and why it's so important?
Yeah, so the blood chemistry review that we do, it's not a super in-depth review, but what we are doing is we're taking the blood work that our clients give to us and we're matching it up with what the functional ranges should be of their blood work. So, like you said, Sarah, when somebody goes to their doctor, and they have their blood work done, a lot of times they'll say, oh, well, it's normal. And that doesn't necessarily mean that they are normal means no symptoms. Normal just means for them and for that group of people in that area that is not considered a disease state. Whereas when we look at it at a functional range, the functional range of where something should be is ideal health. So where we have found that if somebody has a blood level in a specific range, that means that they're in optimal health. They shouldn't be having symptoms. And that's how we look at it. And it gives us some clues to give us kind of a bigger picture, along with running all of the other tests that we run in the couples coaching program.
Yes, we run the food sensitivity, the Dutch test. Dr. Carrie Jones, you can look at that episode, check her out, talking about the Dutch test and also the GI map. And so the blood chemistry is a really a vital part of this. And it really helps us make those more targeted diet, lifestyle, and supplement recommendations to really fast track your success towards having a baby. So what we're going to do now is we'll just kind of give you some highlights of this blood chem review. And we'll start off with the complete metabolic panel and sort of why it's important.
Sure. So, there's some important markers that are included in the Comprehensive Metabolic Panel, or CMP is what it's often referred to. And so some of the important markers in there to note are things like fasting glucose. So that's fasting sugar. That's going to be really important for us to see, because if you have high fasting glucose, that is starting to point towards an issue where you're not able to use carbohydrates and sugars properly. And if it becomes too high, you start getting into that pre-diabetic, diabetic range, and that's not what we want to see. So ideally, for fasting glucose, we want to see it anywhere between 70 and 90 for our American friends, and between 4.0 and about 4.7 for people in Canada and overseas. And that's a really healthy range for a fasting blood sugar or fasting glucose. Now, some of the other markers that we would find on the comprehensive metabolic panel will be things like calcium, potassium, sodium. So those are electrolytes. So we're going to see, how the body is doing balancing the electrolytes. That's really important because if your electrolytes are really out of balance, you could have things like excessive thirst, fatigue, muscles are aching, brain fog, those sorts of things. So it's really, really important that your electrolytes are in balance. And sorry, did you have a comment that you wanted to hop in there about the fasting blood sugar?
No, I think that's fine. Just so 70 to 90 in the States. What's the measurement on that?
So in the United States, it's mg per deciliter.
Okay.
And then it's millimole per liter, I believe, in Canada and overseas. So
Right.
that's the difference. So essentially what we do is we take the number in the US, if you're looking at the US number 70 to 90, and you're dividing it by 18, and that will give you the range for Canada or for most places overseas.
Okay, great. And potassium, you shared a little bit about that one. Why is that one important again?
So potassium is really important because you need adequate levels, obviously, all of the levels. Sodium is also important. So they need to be in good balance because potassium and sodium are the things that, when they're in balance, help us to get hydration in and out of the cells. It's also going to be important for keeping ourselves hydrated, but also not feeling dizzy. So a lot of times when people are potassium deficient or even sodium deficient, they may find that they're really thirsty because they're just not hydrating well enough. They may feel like their muscles are weak and tired, so like heavy feeling in the legs, like you walk upstairs and it's just taking a lot of effort. That could be common. And then some of the things that you might see or associate with like heat stroke, when you've been outside in the heat and sweating a lot and losing a lot of those electrolytes, so tired, headaches, even nausea could be common with electrolyte imbalances. So that's why it's important for us to look at these, and doctors look at them, and most of the time they will flag it if there is a problem. But our body is pretty smart and tries its hardest to keep the electrolyte balance in our blood because it's vital for our health.
Okay. Yeah, my daughter just had a heat stroke a couple weeks ago with a track meet and then soccer that following night, and then found out she had a small tea addiction going on. So even though she was hydrating properly with all the tea, kind of a diuretic, then it just she had all the signs of heat stroke and had to go to the hospital actually and get an IV. So that was not fun, but yeah, it's just amazing kind of. And we've talked to her repeatedly about making sure you're keeping hydrated, but then the tea kettle constantly boiling, not knowing it was like that many cups of tea.
Oh no.
Yeah, yeah. So yeah, and then as far as lipids, so the lipid panel, why is that one important?
Sure. So lipids are going to be your fats or cholesterol. So when you go to get a lipid panel done, it's more known as, I'm going to get my cholesterol checked. And we did talk about it in a podcast about the importance of fats. But when we're looking at a lipid panel, we're looking at your total cholesterol, triglycerides, HDL, or the good cholesterol, and LDL. And so when we're taking a look at this, we want to see some good healthy levels of HDL cholesterol, and we want to see lower levels of triglycerides. So if your triglycerides are actually on the high end, most people would think, well, that means I'm having too much fats, but actually that's not the case. Higher triglycerides is more associated with you having too many carbohydrates and your body is not tolerating them well. And so if you're finding consistently that you're coming back with higher triglycerides, that's where we could look at maybe your diet and see, what kind of carbohydrates are you eating, and maybe let's switching them up to more of a fibrous one, like leafy greens, cruciferous vegetables, those sorts of things, and maybe some just good starchy carbs occasionally, like potatoes, sweet potatoes, yams, squashes, those sorts of things. So we do like to look at these numbers because we have actually honestly seen quite a few people who have had lower cholesterol numbers, which you think is good because people think if you have high cholesterol, it causes heart disease. And so then if it's high, you want to go on a statin. But the truth is you want to have healthy levels of cholesterol because those are the building blocks of hormones. So you
Mm-hmm.
actually don't want your cholesterol to be too low.
Okay. And what are the functional levels for that, for cholesterol?
Sure. So for total cholesterol, the optimal range is between 170 and 200. For triglycerides, we like to see triglycerides lower than 80. And then for HDL, which is the good cholesterol, generally a healthy level is between 55 and 85. And for LDL, that one, we like to see that below 100.
Are these the US levels?
Yes, I don't have the conversion right off the top of my head for
Okay.
Canada, but there's a lot of conversion calculators online that you can use as well.
Okay, awesome. Yes, definitely check out our episode number 16 on healthy fats and fertility, and really why, the baby's brain is made of fat. So making sure that you have those healthy levels, because a lot of the times we're scared of fat, and we've gone on this fat-free craze.
Mhm.
So yeah, so looking at those levels there is important.
Yeah, and I just wanted to put a little bit in here about the cholesterol and lipids. If you are really interested in it and want to dig deeper into it, a great book that I recommend about cholesterol and the importance of it is the book called Cholesterol Clarity by Jimmy Moore. It's written with a fellow doctor, and they do a really, really good job of breaking it down and really explaining all of the numbers and where they should be at.
Okay, great. So the next one we have there is the complete blood count.
Mhm.
Why is that one important?
So this one is important. The complete blood count is basically like a picture of your immune system. So it's going to be looking at things like white blood cells, red blood cells, and then things like lymphocytes, monocytes, neutrophils. Those are markers of your immune system. And so if you are, coming back and you have a high white blood cell count, that could mean if you have a cold or something like that, it could just be because of that, because it's usually higher when you have some sort of infection because your immune system has to work harder to fight it. And so it's really nice to have a glance at these numbers because sometimes they may appear to be normal, but if you look at them functionally, they actually could be a little bit high, cluing us in that maybe there's some underlying infections that we're not aware of that could be going on in the gut. So this is a good thing for us to look at using the blood chemistry analysis to see if it's another clue pointing towards possibly some imbalance in gut bacteria, maybe some fungal or bacterial overgrowth that could be going on.
Any levels you wanted to highlight with the numbers?
There's a lot
Yeah,
in
yeah.
here. So we definitely go through it and show it to you when we go through your numbers with you. So it'd be a lot to unpack be a lot of numbers.
Okay, sure, no problem. Okay, so another important one that we have is the full thyroid panel. And this one is often, a lot of people just get their TSH measured, and we ask to look at the full thyroid panel, which really gives us clues and is very important for fertility.
It is. And so very often you go to your doctor, you'll get a TSH and maybe a total T4 or a free T4. And that only gives us part of the picture. So TSH isn't technically actually thyroid hormone. TSH is a marker of hormones coming from the pituitary. So it's not always the best gauge to see how your thyroid is doing. So if you're going to do a complete thyroid panel, you're going to want to be looking at TSH, free T3, free T4, those are active thyroid hormones, reverse T3, and then we also recommend looking at thyroid antibodies. So TPO, anti-TPO, which is thyroid peroxidase antibodies, or TBG antibodies, which is thyroglobulin antibodies. And those are the two markers that would tell us if your body is creating antibodies towards your thyroid, which could point towards possibly some autoimmunity going on, which is important to know because even if that comes up, sometimes your doctors may just say, well, there's nothing you can really do about it. You have Hashimoto's or Graves and here's some medication. But the reality is that lifestyle plays a very big role in being able to manage the antibodies and any sort of autoimmunity with the thyroid. So knowing whether or not you have these antibodies, we could definitely support you with diet and lifestyle to help bring the antibody numbers down.
Yeah, absolutely. And sometimes people What about not even being diagnosed with an autoimmune when there's antibodies? What's your take on that?
So sometimes what will happen is maybe the antibodies are slightly elevated, and so a doctor might say, well, they're not too high. Let's just monitor it for a little while and see what happens. And that may be okay, but I don't think that that's a good approach, because if you have some antibodies, that's a clue that your body is not happy and that there's some lifestyle changes that need to happen. And ideally, to diagnose a thyroid autoimmune disease, you'll have blood work done, you'll be checking for antibodies, and they would also be doing a thyroid ultrasound to be looking at your thyroid to see if it's inflamed, are there any nodules on there. All of that information is going to be really important. And as I said, lifestyle has a very big impact on the thyroid. And to dig a little bit deeper into that, talking about the T3 and T4 hormones, when we look at the numbers for those, if those are low and high or high, that can give us some clues into gut health or how well your liver is doing, because the gut does play a role in the conversion of thyroid hormones, and so does the liver. So if you are, you have a leaky gut or you have a gut infection, you may not be converting thyroid hormone correctly, and that may be why you're having symptoms of hypothyroidism. So if we uncover a gut infection and we help eradicate that and then start working on allowing the gut to heal, that may help to lower antibodies. It may also help to your body get rid of some of those hypothyroid symptoms. So it's really important to look at all of the numbers and to dig deeper, not just look at a number and say, well, your TSH is high, so let's give you some thyroid hormone. That's not the whole picture.
Yeah. And why is it important for fertility and recurrent miscarriage?
So it's important to have your thyroid numbers in check, because when your thyroid is, like your thyroid is sluggish, that affects the whole body. So it affects metabolism, it slows everything down, it creates stress on the body, which then can have an effect on fertility. And there are a lot of women that report having hypothyroidism and having a very difficult time becoming pregnant, or if they do become pregnant, they have recurrent miscarriages. So it is really important to make sure that you have a full thyroid panel check so you can really see what's going on and get some clues and allow yourself and your doctor and any other practitioners you're working with and what we do to dig deeper into some of the underlying issues that can be going on, so that we can help make the lifestyle changes necessary to see improvements in your thyroid health, which
Awesome.
then has that downstream effect on fertility.
Okay. And as far as the ranges, let me just go, we'll start with TSH.
Sure. So ideally, a good functional range for TSH is going to be between zero point 0.5 and 2.0. Now, there may be some people who feel really good a little bit higher than 2, but that is the general functional range for TSH.
And the free T3?
So for free T3, ideally, we like to see that between 3.4 and 4.4. And for free T4, a good functional range is between 1.4 and 1.8.
And reverse T3?
Reverse T3, we want to see that less than 15 nanograms per deciliter.
Okay.
And then for the antibodies, so for the anti-TPO or the thyroid peroxidase, below 10 is ideal. And for the thyroglobulin or TBG antibody, below 20 is ideal.
Okay, great. Yeah, and these we work on diet and lifestyle in our couples coaching program. If there's a thyroid thing going on, there's lots of things that we can do. So vitamin D.
Vitamin D, that's a big one. So, I mean, I think a lot of our society, it depends on what study you look at, but there's a good percentage of the population that is vitamin D deficient. And vitamin D is really important for several reasons, but one of the biggest ones, it supports the immune system. And so we very, very often see women coming to us with vitamin D levels that are very low.
Mhm.
And that usually correlates when we start looking at a stool test that their immune system has been weakened because they have some sort of parasite or a bacterial infection. And so we've got to do a lot of work to clean that up, to help the gut heal, and to boost the immune system back up. So vitamin D could be a clue on a blood test that would give you some insights into how well your immune system is doing and if you need to dig a little bit deeper. So ideally, we like to see vitamin D between 60 and 80. And we very often see women that are coming in at like 30 or 40,
Yeah.
which is pretty low. And if your immune system is low because it's fighting off something else that you're not aware of, then it's not going to be helpful for fertility because you want your immune system to be robust, to be strong. You don't want to have some underlying stressors that are stressing the body out that's going to affect your fertility. So that's another really good clue for us to look at.
Yeah, and a lot of times your doctor, if it may just ask you to supplement without testing. So we always say test first because vitamin D is a hormone, then to be really monitor your levels. So do you have any tips about that one?
Yeah, it is very important if you're going to supplement with a vitamin D supplement that you want to be checking your levels every few months. So I recommend at least every 3 months if you're supplementing, especially at higher doses of vitamin D. And if you are going to supplement, you want to make sure that you're supplementing with vitamin D3, which is the active usable form of vitamin D. And I also always recommend that you take it in combination with vitamin K2. Both of those vitamins are really important to be taken together because they work synergistically in the body. And if you are taking too much vitamin D, it can have an effect on your calcium and it can have an effect on your vitamin K2. And we don't want that. And by what I mean by that is that if you're taking a lot of vitamin D and it creates an imbalance in calcium, calcium can start depositing in places that you don't want it to. So your soft tissues like arteries or muscles causing muscle aches rather than being deposited into your bones and teeth where we really want it. So it's really important that we can't just take vitamins in isolation. We know that in nature, these vitamins all come together packaged in food. So, for instance, liver is really, really good for vitamin D, but it also comes with calcium and vitamin K2. So it's important to make sure that you're getting all the nutrients together.
Yeah, and I guess as far as fertility, obviously, if there's low vitamin D, you may have PMS symptoms, ovulatory dysfunction. Anything else as far as fertility that people will notice?
Yeah, so I mean, you're going to have some of the common things that are still associated also with thyroid. So fatigue, you may get colds or flus more often, you may feel run down a lot. So those are very common, and it does affect your cycles. So your cycles may become irregular if your vitamin D levels are really low. So it does have a big impact on the body as a whole.
Great. So next one we have is magnesium. And I've actually interviewed Dr. Carolyn Dean. So she's a magnesium expert, actually. And she's telling us that 80% of us are deficient. So check out that interview with Dr. Carolyn Dean on the podcast. But yeah, let's share some functional ranges and why it's important.
So magnesium is super important, and I really, really love Carolyn Dean. She's amazing and has a great book about magnesium.
Mhm.
But the reason that we're seeing more and more people having magnesium deficiency these days is because our soils are becoming depleted. And so the vegetables that are normally high in magnesium aren't uptaking as much magnesium as they were before while they're growing. So we're getting less and less magnesium in our diet. And magnesium isn't important for, I believe, over, and I'm just quoting here, but I think Dr. Dean has actually updated this, but over 300 processes in the body. So it's essential. It's very, very important. Magnesium is important for muscle relaxation. So if you have a lot of tense, tight muscles, that's the same as true if you have a lot of cramping around your period and it just feels really hard and tense and painful. That could be magnesium deficiency because magnesium is responsible for calming and relaxing the muscles. So it's really great for that. It's also important for blood sugar balance. So anytime that you have sugar or a very processed carbohydrate, your body actually has to use several molecules of magnesium to help break that down. So if you're eating a lot of carbohydrates and a lot of sugars, you're actually going to be burning through your magnesium stores very quickly, causing a lot more magnesium deficiency symptoms. Another symptom that you can notice with magnesium that a lot of people may not know is associated with it, but eye twitches. So if you kind of get that eye twitch when you're stressed out, or,
Been there.
yeah, or your thigh twitches, or even Charlie horses, that could be a magnesium deficiency because stress does deplete magnesium. So it's very, very important for a body, like I said, for over 300 processes. And the one test that Dr. Dean does recommend is the RBC magnesium. It's still not ideal. It's not the best test, but that's the best test that we have right now. And so ideally, you would want to see your RBC, or red blood count, magnesium be between 6 and 6.5. So I generally recommend everybody takes magnesium. It's not harmful to take it. I like to recommend taking it before bed just because it does have that calming effect. So if you're somebody that's really wired or stressed out before going to sleep and your brain doesn't shut off, or if you tend to be achy before bed, magnesium is really, really good at calming that down and helping you sleep.
And do you recommend a certain type? Is it magnesium glycinate?
Yeah, so I do like magnesium glycinate. It has less of a digestive upset. So certain forms of magnesium can cause diarrhea. So that's where you may hear people that say, if you're constipated, take milk of magnesia. And that's a form of magnesium that, if taken in enough of a high enough dose, can cause loose stools. So some people do really well with magnesium citrate, which the most common form that people know of is Natural Calm. That one is really good, but some people who have stomachs that are just upset and maybe are irritated, they just can't tolerate the magnesium citrate. It causes loose bowels too quickly. So we really like the magnesium glycinate.
Yeah, and really, as far as it relates to fertility, so a deficiency can elevate your cortisol, which then impacts your sex hormones. Any additional thoughts on that?
Yeah, for sure. As I said before, stress depletes magnesium.
Mhm.
So if you are under a lot of stress, whether it's work stress, or stress with your spouse, or physical stress, like you're working out your body way too hard for too long, that's a stress. If it's the foods that you're eating, all of that is going to deplete magnesium, but it's also going to cause your body to secrete a lot of cortisol, which is important, but we also don't want too much, because then we're in this constant state of fight or flight and our body's on high alert, and that is going to have a big impact on fertility. When your body is worrying about dealing with the stressor, it's not going to worry about procreation and creating hormones for fertility.
Now, B12, why is that one important?
So B12 is important, again, for a lot of different processes in the body. It's especially important for people who are vegetarians. A lot of the food sources of B12 are actually found in animal products. So it is really common to see people who are vegetarians to be low in B12. B12 is also really important for energy, for stress. All of the B vitamins are important for helping you to deal with stress. So we ideally like to see B12 between 800 and 900. And some of the things that I'm commonly seeing is we may have some women who are supplementing with B12, and they'll go to their doctor and their levels are really, really elevated. And that could be that it's either the form that they're taking is not a form that their body can use. So it's just becoming too elevated in the blood and their body's just not using it. And so we always recommend, if you're going to use a B12, you want to use a methylated B12 because that's the form your body can use. But one of the other things that I've learned recently is that there is a connection between B12 and copper toxicity, which is associated with birth control. So if you've been on birth control for long periods of time, it's not uncommon for you to have a copper toxicity, and taking B12 could actually make that worse. So it is really important to test your levels, see what they are. If you're finding that your levels are going really high, it's likely that your body is not absorbing it, and that there could be something going on possibly with a copper imbalance. And so that's where we dig deeper and we start working on the gut, and we look at your lifestyle and things that you're taking in, environmental toxins, and we start to help clean that up.
Yeah, it's also important for male fertility, so for sperm count,
Yeah.
female fertility, so a miscarriage risk. And also, yeah, it can be lowered by taking hormonal birth control if you have a leaky gut, if there's inflammation going on. So these are then all clues when we look at it and say, oh, why is it low?
Right. And that's important. As I said, some of the highest levels of B vitamins and B12 especially are found in animal products. So if you're eating a lot of really great foods, like you're eating organic, you're getting grass-fed meats, but your B12 levels are still really low, that is a clue that you're not actually absorbing and breaking down that food that you're eating. And it's a good idea to look at the health of the gut.
Yeah, there's also studies indicating that metformin can reduce your B12 as well,
Yes.
which a lot of
Yes.
women that have PCOS are put on.
Yes.
Okay, so iron. Why is that
Iron.
important?
Iron, especially for women, iron is really important because, again, it carries oxygen in the blood. It gives us energy. It's associated with health of hair and nails. It's very highly tied to the thyroid. And because women are menstruating every month, we are losing blood. So we're naturally going to be losing some of our iron stores. So it's not uncommon for women to be somewhat deficient in iron. And this is also especially true if you are not eating enough good sources of iron. So things like red meats, chicken, and then some of the leafy greens like spinach. If you are not eating enough of those, or if you are, but you're actually not using them and breaking them down because there's something going on in your gut, you're going to become iron deficient, which is going to have a big impact on fertility. It can be associated with miscarriage, and you also don't want to have low iron levels while you're pregnant because you need to have enough to support a pregnancy and to pass on to your baby while it's growing.
Yeah, and it impacts your egg health, and it could be linked to anovulation.
Mm-hmm.
Okay, so functional levels. What are we looking at?
So iron, so serum iron, ideally we want to see that between 85 and 130. For iron saturation, so that's the percentage of iron in the blood, between 25 and 35. And then for ferritin, which is a marker of the amount of stored iron that you have, we like to see that between 50 and 100.
Great. So fasting insulin.
Insulin. So this is one that we don't really talk a lot about, but insulin is really important. And one of the reasons that we should be talking more about insulin, and I think doctors should be testing that, is that you can see changes in your fasting insulin long before you can see drastic changes in your fasting blood sugar. So fasting insulin can give you an indication, possibly years before fasting glucose can, or fasting blood sugar, that you may be pre-diabetic or heading into diabetes. So we ideally would want to see fasting insulin levels between 1 and 5. And the reason that it's important to keep your insulin levels low is because higher amounts of insulin will lead to insulin resistance, and then that can lead to type 2 diabetes. And higher insulin levels has also been associated with high blood pressure, with calcification in the arteries, so cardiovascular disease, heart attacks. The high insulin for long periods of time and high glucose for long periods of time damages the cells. So it actually creates oxidative stress, which basically damages your DNA and damages your cells and leads to accelerated aging. And it's also been associated with certain cancers. So if you have high insulin and high blood sugar for years and it's not being caught and taken care of, there are many cancer patients who may have had this going on for years before their diagnosis. So it's really, really important to keep that in check. And having an elevated insulin is a stress on the body, which is going to affect fertility. So you want to make sure that that is in the normal range. And it is also especially important while you are pregnant, because you don't want to get to the point where your body isn't able to regulate insulin and blood sugar, and you could then get prenatal diabetes. Not prenatal diabetes, sorry.
Gestational.
Gestational diabetes, yes, which gestational diabetes can cause complications while you're pregnant and during labor, and it also has been associated with higher birth weights in children. So it's really, really important to look at insulin levels and blood sugar levels and try to get those in check and get your body really using sugars and carbohydrates correctly.
Okay, so the levels are 1 to 5, and it also, insulin resistance impacts implantation, increases the risk of miscarriage, it disrupts ovulation, and obviously this is especially important for if you have insulin resistant PCOS.
Yes, yes. And we're seeing this more and more, that there's a lot of people who are just becoming more insulin resistant as time goes on, especially as you get older. So if you are trying to conceive in later years, like in your late 30s or into your early 40s, this is going to be really important as well. Because the older we get, the more likelihood is that if we're not eating a correct diet and exercising enough and looking at these levels, it's easier for us to become insulin resistant.
Okay, so the next one we have is the HSCRP, or the high sensitivity C-reactive protein. So why is this one important?
So this one's important because it gives us some clues into inflammation in the body. So if your HSCRP is high, that's an indication that you have some high levels of inflammation, and that's not a good thing. So inflammation could be going on for several different reasons. It could be because you just had an injury. So if that happens, your inflammation levels are going to go up. If you have any sort of infection, acute infection, or maybe an infection that you don't know of that's kind of going on in your gut, your inflammation could be up. If you have some insulin resistant or some high blood sugars, your inflammation could be up. If you have some food sensitivities, so you're eating foods on a very regular basis that your body's not tolerating, that can cause an increase in inflammation. And when your body is inflamed, it's kind of in that stress state again that we are always talking about, that fight or flight. And when you're in a fight or flight response all the time, it has a very, very big impact on fertility.
Yeah, and I guess that chronic versus acute inflammation. Can you talk a little bit about that?
So acute would be something that just happened. So if you got the flu, or you've got a cold, or maybe let's say you've just had a car accident, that would be considered acute because it's something that just recently happened. Chronic is something that is very low level. It's been going on for a long period of time. And a lot of times we may not even be aware that we have chronic underlying inflammation. For some people, if it goes on long enough, they'll start having joint pain and inflammation, and that's definitely a sign. But many of us are walking around with low level chronic inflammation and not know about it because of blood sugar issues, gut pathogens, even mental emotional stress that goes on for too long can create low level chronic inflammation.
Yeah, so those gut infections, a leaky gut, are good indicators. And that's a lot of people that we work with have a gut infection.
Yes, yes, it's very, very common for us to find that.
As far as levels, what are we looking at?
So for women, we want to see your HSCRP lower or below 1.5, and for men, ideally below 0.5.
And then the last one we have is the MTHFR. So let's talk about that. This is a massive topic, and a great resource for this is Dr. Ben Lynch, if you want to go into super detail, but we always ask for this on our review to give us some more clues as to what may be happening.
Sure. So I'm just going to give a really high level overview because this is not my area of expertise, but MTHFR is methyl tetrahydrofolate reductase. It's an
Woo.
enzyme. It's an enzymatic reaction or an enzyme in the body that is responsible for the conversion of certain B vitamins. And there is actually a good percentage. I believe Dr. Lynch states around 60%, it may be off, but have some form of another of the MTHFR gene mutation. And so you can either be heterozygous, meaning you have one positive gene from one parent and a negative gene from another parent. So meaning you have one that says you have the mutation and one that says you don't. Or you can be homozygous, meaning you have two genes. So you've got a copy of each of the genes from each of your parents, and both of them said, yes, you have this gene mutation. Now, it's really, really important for me to point this out from the very beginning. Just because you have the MTHFR gene mutation doesn't always mean that gene mutation is turned on. So, meaning it doesn't necessarily mean that it's actively causing a problem. And if you know anything about Dr. Ben Lynch's work, he talks a lot about how lifestyle is the thing that will turn genes on or off.
Mhm.
So if you have the gene but your lifestyle is really good, it may not be having an effect on you. But if you have been under chronic stress, you have infections, you've been exposed to environmental toxins as a child, you're eating the standard American diet, and this has been going on for a long time, and you're having a lot of symptoms and fertility issues, then the gene may be turned on. And so another misconception is people will think, well, if I have MTHFR, then I need to make sure that I am taking methylfolate and that will fix the problem, and methyl B vitamins. That's only part of the puzzle. Those are important, but there's a lot of other things going on behind the scenes that need to be looked at. And just taking methyl B vitamins may actually cause more symptoms and may not be beneficial, because it could be that you have a lot of inflammation going on. It could be that your liver is not detoxifying properly. And so when you take these B vitamins, it actually causes a detox reaction and your body can't tolerate it. So it can make you feel really crummy. So it is really important that if you do have MTHFR, that you work with somebody that's very familiar with it, and they aren't just going to say, okay, just take methyl B vitamins. You definitely have to dig deeper. But this gene has been associated with inability to sustain a pregnancy. So that's why it's a marker that we do have women, we ask them to try to see if they can get. And if they are positive for it, either heterozygous or homozygous, that's when we kind of dig deeper into all the things that we do. Food sensitivities, how is your blood sugar doing? How's the health of your gut? What's going on with your hormones? These are all really, really important things to look at if you have an MTHFR gene mutation and we think that the gene is turned on and expressing itself.
Yeah, it's really, so it makes your body's ability to utilize folic acid very, very difficult. And so sometimes we do those, there's a lot of foods that are fortified with folic acid. So if you have this, you want to completely avoid those.
Right, because it's going to slow, your body's not going to be able to use it. It's a synthetic form of folic acid. You want to be using the active form. So if you are eating a lot of foods that are fortified, and many prenatal vitamins have the synthetic form,
Mhm.
your body's not going to be able to use it. And it's not a good form for you to be taking if you have this gene mutation.
So it's especially important for recurrent miscarriage, unexplained infertility, and also if you have those elevated homocysteine levels, which we haven't talked about.
Right, and homocysteine is kind of similar as the HSCRP. It kind of gives us some clues into some inflammation and how well your body is utilizing some of the B vitamins. So it ties in with MTHFR and B12. It can get super complicated, but again, making sure that you're eating your if you're taking supplements, take the right form. And if you have had recurrent miscarriages and you've been really struggling to get pregnant, it is worthwhile checking to see if you do have the MTHFR gene mutation, and most doctors can test for it.
Awesome. Okay. So yeah, so as far as after next steps after the blood chem review, typically we will review your stool test. So we use the GI map, looks at the DNA of your stool, and also the Dutch test looks at your hormones using urine, and then the blood chem to really get a full picture of what's happening. Do you want to share a little bit about that?
Yeah, so as I kind of mentioned off at the beginning of the show, we use the blood chemistry analysis to kind of keep building on this picture or this foundation that we are starting to build about the clients that we're working with. So they all work together to give us clues as to what can be going on, and it allows us to dig deeper to find some of the underlying causes that possibly could be contributing to infertility. So we take the information, we compare it to what we find on the Dutch test, we also compare it to what we find on the GI map, and we create a personalized protocol for you.
Yeah, and really this review is extremely essential if you've been told that all your blood work is normal, and especially if you have unexplained infertility, because through the lens of functional medicine, it's not unexplained. There's always a reason.
Yeah, I mean, a lot of times a lot of the numbers do come back and they look good, but the odd time we will look at the functional range of like a fasting blood sugar and somebody's been told, well, your blood sugar looks great. But if we look at it, it's looking like it's creeping up there, and that the client that we're working with may not be tolerating carbohydrates correctly. And so that tends to be a bit of an easier fix. Like, we can work on diet, we can talk about some exercises that are going to help with blood sugar, and just some minor lifestyle changes can make a big difference and bring that number down. So we don't always find a lot of things, but sometimes there are some clues that might have been missed, and it all ties together.
Absolutely. Awesome. So this is part of our couples coaching program. Definitely check out episode number 6 for more details about the couples coaching program. If you did just want a blood chem review by itself, that's if you go to fabfertile.com, you can check out the blood chemistry review there. The price is listed. But we recommend, obviously we look at the whole body, and so the blood chem is only part of this whole equation, but it does give us definitely some good clues and some starting points.
Yeah, it does. It's a good starting point for you to kind of jump in and have a taste of how we look at it differently. And a lot of times when we do a blood chemistry review, we will come back and give some recommendations for some possible further testing to dig a little bit deeper.
Awesome. Great. Well, thanks for joining us again today, Brandy, and everyone, have yourself a fabulous day.
Thank you.
Hey there, Sarah Clark here. So are you struggling to have your baby? First of all, please know that my heart goes out to you. I support couples worldwide who are struggling with infertility to conceive and have healthy babies. Women like Rita, who gave birth to her beautiful daughter after following my fertility coaching system. Or Danielle, who after 2 failed IUIs was able to get pregnant after a supercharger fertility discovery call with me. So here's how you get my help for free. So I offer a free supercharger fertility discovery call, and on that call, I'll create a plan with you that is going to help you fast track your success. So this call is not for everyone, and I'm really picky about who I get to speak with. And I have a strict but totally reasonable criteria that needs to be met in order for us to move forward. So here's who I can help. So first of all, you need to be able to explore your infertility diagnosis in a new light. So this offers for people who are open-minded, they're coachable, and if you can do that and want to double or triple your chances at the fertility clinic or get pregnant, awesome. So let's get on the phone and chat. Also, you must be an action taker. So someone who's committed to seeing results, you're able to follow directions. Don't worry, I'm not going to ask you to do anything bizarre. But if you're one of those people who like to consume a ton of information, but don't like to spend time implementing and seeing results, then the call's not really for you. So I only want to spend time with people who are genuinely committed to their own success. So just click on the link in the show notes and apply, or go to fabfertile.com and click on the free consult. So it's a really short application that just tells you about your health, how long you've been trying to conceive, and how soon you'd like to be pregnant. So seriously, this is going to be the best time you've ever spent on your fertility. Looking forward to chatting. Talk soon. Thank you for listening to Get Pregnant Naturally. Seriously, it means the world to me that you're here. Make sure you hit the subscribe button so you can be notified of upcoming episodes. I'm excited to offer you a special gift. If you're a U.S. resident, text FERTILE to 345-345. You'll be prompted to enter your email address and you'll receive our fertility yoga download. In this 20-minute intro video, we focus on a calming and peaceful practice to connect back to your heart. These simple fertility yoga poses can help quiet negative thoughts and make you feel more in control. Download it now and get started today. So for U.S. residents, text FERTILE, FERTILE, to 345-345. For non-U.S. residents, go to www.yogafreebie.com to access your special gift. That's www.yogafreebie.com to access the free fertility yoga download. And I love this quote by Dr. Mark Hyman, medical director of the Cleveland Clinic Center for Functional Medicine and chairman of the Institute for Functional Medicine. Functional medicine is medicine by cause, not by symptom. Functional medicine practitioners don't in fact treat disease. We treat your body's ecosystem. We get rid of the bad stuff, put in the good stuff, and because your body is an intelligent system, it does the rest. Thanks for listening. Until next time.